morning. Good morning, you guys. Thank you so much for joining me this morning. Dr. Crystal Chanel here. Just popping on very quickly. You guys can see my eyes. I have been doing chemo since October of 2024, and all types of different medications, of course, that I have been taking over that course of time. But unfortunately, I have been affected in my eyes tremendously since October when I started treatment. For some reason, my eyes, they go down, and then they also continue to swell. I'm assuming, as they stated, it's one of the side effects from one of the medications or some of the medications that I'm taking. But to God be the glory for all the things He has done. I am actually at the hospital at Emory doing my treatment. And as you can see, they got me all hooked up here. My cranberry juice. I'll drink that soon. But yeah, just wanted to pop on this morning to encourage someone as I encourage myself to continue to focus on the positive things. If we focus on the negative things and the evil things in life, the devil has won. But if we remain positive and focus on the positive things, then God has won. Thank you guys for joining me. Thank you so much for popping into my live. Dr. Crystal Chanel here. Just wanted to, again, come on very quickly just to encourage someone this morning. There's been a lot going on. And you don't have to worry about the blankets because I was cold a few minutes ago, but now the menopause is kicking in.
You.
But I would love some water.
Down those first.
Okay.
Water, do you want warm, room temperature or cold?
Just room temperature is fine.
So that's the condition.
Okay.
And this article I listed here was talking about like what they used with the patients.
Okay, perfect.
This is a different article, but it shows on this lady like.
Oh, yes. Yes. This is what's been happening. And it's been causing my eyes to bleed as well. Okay, that's good to know.
Reach out to them.
Okay.
They may be weary of prescribing it for you. They may want you to go back to the ophthalmologist too. So this is just my prediction and assumptions, but can get started with that.
Thank you, Leah. I really appreciate you.
I'll be back with your water.
Thank you, love. Hi, you guys. Thanks for joining. But anyway, as I was saying, that a lot of people are going through so many different storms, trials, tribulations. Myself, my family and I are grieving my nephew's death. We're grieving my aunt's death. My neighbor passed away. Thank you so much, Leah. My neighbor passed away. And it's amazing because my neighbor, she is from Tuggo. And the only thing that she could speak was like good morning or hello. And my girlfriend, who is from Ghana, stated that her daughter wanted to know who lived in the house, which was my house, towards the ending of the street, because her mother stated that I was her best friend, but she could not speak to me in English. But we showed love through just simply waving at one another, and the joy that I gave to her and she gave to me through just a simple wave. was absolutely amazing. Not knowing that I was this lady's best friend, but she couldn't even speak to me in English. Told her daughter that she wanted to speak to me, but she didn't know how to speak English, but I was her best friend. The tears that shed from my eyes. We have to take life very seriously, and we can't take life for granted, because people are truly, truly, truly leaving here. I also saw one of my pastor friends, him and his wife, they lost their son. I used to do praise and worship for this particular pastor, and when I got up yesterday morning, in the middle of the morning, I went to Facebook and saw this post. It was very disturbing to my spirit. Now, my neighbor, I just waved at her on Monday morning, just as happy as we could be, waving at each other. And then 2 o'clock Tuesday morning, she was no longer here. She was 68 years old. But I want to encourage you guys to, we always state, are you your sister's keeper? Are you your brother's keeper? And I think a lot of times people make that statement just to say it, but they don't truly understand the true meaning. Some people don't truly understand the true meaning of, are you my sister's keeper? Are you my brother's keeper? We all are going through things in life, but at the end of the day, we have to try our very best to be there for one another, because we never know when it may be your turn. I tell people all the time, everybody has a time and everybody has a turn. Sometimes people pretend to be so busy that they can't pick up the phone to call someone, that they can't send someone a simple text, they can't send or stop by someone's home, even if it's just for 30 minutes, whatever that looks like. We have to do better when it comes to being our sister's keeper or our brother's keeper. We have to really do better in that area, because a lot of people are going through things silently when they don't have to. I remember when I started this cancer journey, I had people that were there in the beginning, that left in the middle, and disappeared in the ending. I had people to be there, not in the beginning, but came in the middle and here towards the ending. So it's been a emotional roller coaster. Good morning, D Hill. God bless you. Thank you for popping in. It's been an emotional roller coaster, having people in and out my life throughout these trying times. And when you fall sick or you're going through an illness or a disease, that's when you know who your true friends are. That's when you know who your true circle. That's when you realize who your tribe truly is. That's when you realize who your community really is. Because so many people pretend to be your sister, pretend to be your brother. Again, I asked this morning, are you your sister's keeper? Are you your brother's keeper? And not to just say it, just to say it. Truly showing up for people. Everybody needs somebody. Everybody needs somebody. D Hill, I am actually getting my treatment. I'm not finished with treatment at all. So not to say that it came back, it never left yet, sweetheart. So by God's grace, I will be healed in Jesus' name. As I sit here in this hospital with other patients, I'm praying for all of us to be healed in Jesus' name. We have to try our very best to make sure that we're eating right and doing all the things that we could possibly do for ourselves and for our health, because it's very, very important. Very, very important. I went to a multiple myeloma event on Sunday, and listening to the panel on Sunday and how they stated 34,000 people got diagnosed in 2024, I believe, or either 2023 with multiple myeloma. And they're predicting 36,000 more, I believe, for 2025, if I'm not mistaken, or 2026. I think I have the dates wrong, but I have to go back and listen to the video to get the actual correct numbers that they stated. But however, that's an extremely, extremely large amount of people. So I want to encourage you that when you are going to the doctor, to make sure you're asking them for a complete blood workup, checking your CBCs, your white blood cells, your red blood cells. Knowing the numbers are very, very important. My situation kind of started when I was in high school. I was always cold, and I was going through anemic. I was very anemic, and it started there with me being anemic, and then also too much protein in the urine. And at that time, I would ask my doctor, what could I do, to possibly stop this from happening. But sometimes it's just what your body does, and unfortunately, some things we just don't have any control over. Some things we just don't have any control over. Welcome in, you guys. Welcome in. Thank you so much for joining me. Dr. Crystal Chanel here. Just wanted to come on this morning just to chat a little bit in regards to just truly asking the question, are you your sister's keeper? Are you your sister's keeper? Are you your brother's keepers? And just encouraging you guys to live life, appreciate life, truly show up for people as if you would want them to show up for you and your family. A lot of people are suffering in silence. A lot of people are going through things alone, and they don't have to. I just recently met a multiple myeloma patient. She's in her 60s or 70s. I can't remember, but she just got diagnosed, and she doesn't live too far from me. She doesn't have any family here. So at the end of the day, who's going to be there for her while she goes into the hospital? Who's going to be there for her when she comes home from the hospital? So guess what? I gave her my number, and even though I'm still going through my own treatment, I'm going to be there for her as much as I possibly can. Again, are you your sister's keeper? Are you your brother's keeper? Look, are you your mother's keeper? Are you your father's keeper? I'm going to go a little deeper. Are you your aunt's keeper? Are you your uncle's keeper? Are you your nieces and nephews' keeper? Are you your neighbor's keeper? Life is happening. It breaks my heart because when I look on social media, all you see is R.I.P. Rest in peace. All you see is R.I.P. Rest in peace. It's heartbreaking. People's hearts cannot take everything that's happening in the world. Between the White House, a lot is happening. People's homes are being destroyed. People's homes are they're being separated from their families. All types of things are happening. We have to really put our trust in God. We have to really pray and ask God to cover us under the blood as we go through life. We continue to live this thing called life. you woke up this morning, so you still have purpose. You're still here for a reason. A lot of people don't know what their purpose looks like and why they're still here. If your eyes was open this morning, you still have purpose. My eyes are swollen from my medication. I guess it's a side effect from the medication. So this one has been hurting really badly, but it's not that bad anymore. The pain is kind of going away just a little. But I'm like, okay, Lord, I could have this thing any place, but why my eyes? Why my face? You know, our face is one of the most precious areas that we treasure. But it's okay.
There you go.
I'm still alive, and that's all that matters. I'm still alive. So you guys, I want to encourage you today to make sure that you go to the doctor, get yourself checked. Don't delay your health. It's very important. Me being a therapist and a life coach, I always talk about mental wellness, self-care, how important it is, and also incorporating, exercise, incorporating eating well, incorporating sleeping well, incorporating going outside and getting you some vitamin D. Now it's about to be winter time, so we're not going to have much sun going on, right? But during those winter times, then you need to make sure you consult your doctor, because you may need to get some vitamin D in your system. Because in the winter time, we're typically in the house, and there's no sun really for us to go outside to get that vitamin D that we need. So make sure you consult your doctor, keep up with your vitamin D levels. And if you need vitamin D, you're deficient in that area, make sure you get some vitamin D. Okay, so I'm not going to stay on, you guys. I'm getting my treatment. They got me all hooked up. Got me all hooked up here. But just know that Dr. Crystal Chanel love each and every one of you guys. Thank you so much for joining me. Thank you for just popping in on my live this morning. If you are my friend and you've already been following me, I want to say thank you. And if you have not had the opportunity to do so, follow me and I'll make sure I follow you back. Peace and blessings until next time.
All done.